If you were really having chest pain, you'd be on the floor screaming!
The entire waiting room went silent. Everyone stared. An elderly woman sat in her chair, calm, hand pressed to her chest, eyes wet, but she didn't cry. A nurse had just screamed at her in front of 50 people. The woman had been waiting 2 hours, quietly, in pain. She told the receptionist when she arrived. Chest pain, mild, but something feels wrong. They told her to wait, so she waited. A young nurse nearby saw everything, rushed over. "Sarah, she said chest pain. We need to triage her immediately." The senior nurse spun around. "Emma, look at her. Does she look like she's dying? She's 70 years old, probably just indigestion. These people come to the ER for every little thing because they don't want to pay a copay." Emma looked at the elderly woman. "Ma'am, are you in pain right now?" The woman nodded quietly. Emma turned back to Sarah. "Then we need to—" "Enough!" Sarah grabbed Emma's arm, pulled her aside. "You're new here. Let me teach you something. You assess by looking. This woman is calm, talking, smiling. Real cardiac patients, they're gray, sweating, panicking. She's fine, and we have actual emergencies waiting." At that exact moment, the emergency doors opened. A doctor in scrubs walked through. He saw the elderly woman, stopped. His head went pale. "Mrs. Anderson?" He ran over, knelt beside her. "How long have you been here?" "About 2 hours, David." His head snapped to Sarah. "You let Dr. Anderson sit here for 2 hours with chest pain and didn't assess her?" Sarah's face changed. "Dr. Anderson?" The doctor stood up, voice shaking with rage. "This is Dr. Margaret Anderson, retired chief of cardiology. She worked at this hospital for 35 years. She trained me. She trained most of the cardiologists here. She donated $4 million to build this emergency wing. Every monitor you use, every defibrillator, every cardiac bed, she paid for it. And you just screamed at her to get out." Sarah couldn't speak. Dr. Anderson smiled softly. "It's all right, David. I wanted to see something." She looked at Sarah. "I've been having silent heart attacks, no dramatic symptoms, just discomfort. I wanted to see how someone like me would be treated when they don't look like what you expect." She paused. "Now I know." Emma helped Dr. Anderson to a bed. Full cardiac workup, 3 blocked arteries, emergency surgery. She survived. Sarah was terminated immediately. Emma, Dr. Anderson paid for her entire nurse practitioner program. The lesson? The quiet patient who doesn't scream loud enough might be the reason the hospital exists. Never decide who deserves care by how sick they look. If you agreed with that, drop a heart in the comments.